My friend Hazem, who is an artist in Gaza, he recently wrote an op-ed about how a song sung cannot be killed. I think that really speaks to the power of art to not only document a present moment, but really archive a persistent history. It brings forward to us these really true, very threatened legacies to the forefront so that art can be a facilitator of not only an individual healing, but that of a collective and shared one.
The idea of stats and stanzas, it really started with, I'm trained as a social epidemiologist. Epidemiology is all about counting things, right? The distribution of diseases and the cause of disease. We use math. We want an effect estimate. We want someone to see that there's a statistical relationship connecting this thing to this other thing over here. Where I'm from, nobody knows what epidemiology is. Nobody cares. They're not waiting for the math, right? We grew up listening to music. We grew up rapping. We grew up reading poetry, right? We grew up dancing. Those are the forms of communication that get us energized on some level, right? And so I think that for me with stats and stanzas, what it's really about is how can we take these topics that we know empirically from the science, statistically, are true, and tell those same stories. With this event, I think at minimum, we would want folks to just acknowledge that poetry and other creative arts, other ways of knowing, creative ways of knowing, they belong in the conversation, right?
Tonight we learned that there is a hunger and an appetite to share poetry and stories that really bring forward what it is that we're fighting for. Dr. Ryan Petteway brought the opportunity to us to really archive what was happening in our organizing within Health Promotion Practice Journal, and the opportunity to bring poems published in an academic journal.
We were very excited to release the second edition of Racism, Science, and Tools for the Public Health Professional last year. We wanted to reach the larger public health community. The first edition of the book was really focused on laying the foundation for how we needed to understand racism as a public health issue. This edition, with Dr. Ford and myself, we really wanted to create a foundation for what do we need to do to move forward and how do we need to move that forward.
All public health professionals need to be aware of and understand how racism matters for doing our work, because public health purports to promote optimal health for all. And we know from the evidence that the for all part of our mission as a field cannot be achieved unless we address racism along with other social injustices.
When I first started doing this, I had to write papers, theoretical, conceptual papers, to convince journals that this belongs. I had to go back and forth with editors. I had to make an argument. The chapters that I co-authored, chapter 22 and chapter 24 in a book, that first chapter in a book was about that argument, right? The second chapter was trying to take what we outlined on the theoretical, conceptual aspect of the first chapter and apply it more concretely, more tangibly into the current context. We hope folks can read these chapters, leave this event with the sense that there is actually something really important here and something they can tangibly act upon to move it forward.
I promise you, there is a poem written about everything. And I think that if we bring poetry more forward, even in the beginning of singing a song, it shifts the atmosphere. And I think what we're realizing is that imagination is a critical public health issue, and poetry facilitates a very holy knowing that there's got to be more than disconnection. There's got to be more than kind of business as usual.
These kind of events are so important for the public health community because these are the ways that people naturally communicate. These are the ways that people find inspiration, that they are able to dream, that they're able to really live and think about the foundations of how they're going to survive and how they're going to thrive in the work that they're trying to do.
It's critical in this moment when so many people feel discouraged in public health that we reconnect to our humanity in order to advance and continue moving this important work forward. Poetry allows us to do that.